Hudson Kunsa can now afford to smile. The health worker was undergoing Ebola treatment at a hospital in Entebbe, near the capital Kampala, before being finally discharged after days in isolation. He contracted Ebola while treating an Ebola patient at a hospital in central Uganda.
I was down for around like 2 weeks, and that process was not good. You felt like every part of your body is hurting, you're weak, you're vomiting.
Uganda is currently battling an Ebola outbreak that began in September. 5 districts are affected. The situation is already worrying health authorities across the continent. This emergency meeting in Uganda's capital, Kampala, was called to find immediate remedies amid fears that the disease could spread to neighboring countries.
We all should be listening and collaborating and coordinating and setting goals and agenda that we can all follow so that we are all careful in terms of making sure that these diseases don't travel all over.
The World Health Organization has been quick to respond to Uganda's situation. $2 million have been extended to Uganda to support its Ebola response. The WHO has also released $3 million for emergencies to support readiness in neighboring countries. Health experts agree that Ebola poses a huge threat to the continent, and every measure to respond to an outbreak is crucial. Among those is the development of vaccines to fight the spread of the virus. The Ebola vaccines that have been effective in controlling recent outbreaks in neighboring Democratic Republic of Congo are not effective against the Ebola Sudan strain responsible for the current outbreak in Uganda.
We do not have a vaccine at the moment that can be deployed to stop the outbreak. Research is going on, and what we have now is what we call candidate vaccines that are under clinical trial. So in the next 1 or 2 weeks, they'll be introduced in the country.
The news of a vaccine trial could offer some reprieve. One death in the capital Kampala has caused huge concern, and there are fears that efforts so far to contain the disease are not enough.